For imaging the brain, most of our imaging will occur through the anterior fontanelle, which is palpable as a softer spot in the skull. Once we find this location, we want to use plenty of gel to make sure we get good contact through the hair. We will angle as far anterior as possible and then move stepwise posteriorly, taking representative images. We try to keep our image as symmetric as possible between the two hemispheres, moving all the way posteriorly through the occipital lobe. Next, we will perform imaging in the sagittal plane. We will angle the probe as far lateral as possible, moving towards midline again in a stepwise fashion. Once you reach midline, continue on to image the contralateral brain. Imaging through the mastoid fontanelle can assist in visualization of the posterior fossa. Place the probe behind the ear and angle the notch towards the eyebrow. Here we can best visualize the cerebellum and the fourth ventricle. Either side can be imaged for best visualization of either cerebellar lobe. Keep in mind, this fontanelle may not be open depending on the age of your patient. It's also important to look with a linear, high-frequency transducer for evaluation of the extra-axial spaces, as well as the more central brain parenchyma. However, our visualization of the lateral brain parenchyma is more limited. Doppler imaging can be performed to demonstrate vessels traversing through the extraaxial fluid. We also perform our measurements of the ventricular index from the lateral wall of the lateral ventricle to the level of the falx. We also measure the sinocortical width and craniocortical width utilizing this transducer.